Afternoon or good morning, good evening, everyone, depending on where you're joining from. Thank you all for joining. Again, another in our ongoing Decoding Data and Digital Health webinar series here from the WHO Regional Office from Europe. I'm Ryan DeSantis. I will be introducing, and then I'll be handing over to our esteemed moderator and panelists. I'll do a brief introductory presentation on this, electronic health records in the age of AI. And this is more from a policy and governance and the underlying strengths and building blocks we need to put in place in order to have sustainable EHRs that support and enable the use and implementation of AI. So it's not necessarily in the technical AI aspects, but more on governance aspects. Coming out of that presentation, we'll go straight into the panel discussion, and we will also, after that, try to field some questions from the audience. Or if there are questions that are important, we will bring them up in the Q&A. So just to introduce my panelists, and you'll see more and hear more from them. We have Mark Lang, who is the Secretary General of ETEL. We have Lucinda Schroff, who is a staff clinical specialist at Google, and she looks at the interface between the clinical aspects and all the other aspects of implementation within EHRs, AI, and all of the innovative technologies that are happening. We have Fadi Saad, who is the Chief Technology and Information Officer at Relate Perform, and he's also an Axos, and he is working with and representing the Asian Development Bank, ADB, in this. Because this webinar is actually coming about as some collaborative partnerships between work that's been going on here in WHO Europe and or work that has also importantly been going on in ADB, because we have some overlap with some of the countries, overlap both in ADB and also here in the WHO European region. And last but not least, we have who will be moderating Donna Henderson, who is the Head of International Engagement for Digital Health and Care, NHS Scotland. So you'll see and hear more from them as we proceed. Allow me now to just do my quick presentation. 1 second as I share this. Electronic health records in the age of AI. So just some quick definitions. Electronic health records are real-time patient-centered records that provide immediate and secure information to authorized users. It basically typically contains a records of the patient's medical history, diagnosis, treatment, medication, allergies, radiology. So your entire ecosystem of care, including even aspects such as your prescriptions and so on, are all encompass this. Versus an EMR or electronic medical record, which an electronic medical record traditionally mimics your paper record in a manual system, versus the EHR, which is the entire ecosystem of all your medical history and what is happening. As noted, it expands the information in the traditional paper-based medical record by making it digital, easy to search, analyze, and share. And an important aspect of this is your EHRs are also, in many cases, well, it should be interoperable in best practices. So your medical records can be shared with other various aspects of the healthcare ecosystem. So in terms of EHRs, what does the data show? In our recent survey that we have done a while back across the WHO European region, is important to note that 87% of our member states at the time, 45 out of 52, reported either having a national EHR system or interconnected regional EHRs or patient portals. So that was quite a large amount across our member states. And 91% of those member states noted that they have also legislation supporting the use of the national EHRs. And 82% of member states, 37 out of 45, who reported, they also routinely made prescriptions electronically available to pharmacies. And that was incorporated into their entire ecosystem. And if you notice some of the ways it was used in terms of primary care, there was a high percentage who routinely used this. In secondary care, there was also a large amount. And in tertiary care, also a large amount using this. Versus other aspects, some member states use it occasionally also. So there's quite a high usage of EHRs. So what does that mean? That's why it's important. A lot of member states are calling for, we have EHRs and AI is coming. AI is actually here. The revolution is happening, so to speak. How can we utilize AI? But key challenges. 37% of member states reported insufficient funding as one of the most important barriers to EHR implementation. So if you want to add AI on top of that, you will also need to ensure you have proper funding. 31% of member states reported available capacities to train human resources, but there was also, that shows that there's still a gap in terms of human resources who are trained for EHR programs. Again, adding AI on top of that means that that could increase the gap in trained human resources. And of course, 98% of our member states across the board noted that a very important aspect in terms of health data governance, including aspects of EHR implementation and so on, interoperability was prime importance across all our member states by and large. And 22% reported that legal concerns were also very important. And all of these have implications when you want to bring AI into the mix. So in terms of use, already in use, AI is already being used in imaging in a lot of places. Radiology is a huge part of this. And AI can also help to bring, just from static record keeping within an EHR, to actually use that data for dynamic decision support in EHR systems. You know, for example, in areas such as trash and so on, you can have clinical decision support systems built in. And in many cases, that's already started to happen. Also, key AI applications, you can do such aspects as predictive analytics, early diagnosis. You can do automated workflows and reducing administrative burden. So it's not just from the clinical aspects, but also from the administrative aspects. It can be very important. And of course, personalized data-driven care. However, how do we get there? How do we ensure that in using AI or trying to implement AI systems, that we have that good, strong underlying EHR basis? How can we utilize the EHRs we have for AI, and how can we ensure that the data, the information, and so on that we're feeding into our EHRs is of good, high enough quality that it actually goes in and gives us good, high enough quality, sustainable, ethically driven AI systems, and how that entire ecosystem can support back and forth. So in this expert panel discussion, we look at the promise of AI, we look at the challenges and the barriers and governance and policy solutions, and as much as we can, start to think about the future of AI-driven EHRs. So thank you. I'll stop sharing. So thank you all for that. Now, what I will do, I will hand over to my esteemed colleague who will be leading this session for the remainder of this, Donna Henderson. Donna, you would like to take over? Over to you and over to the rest of our speakers.
Great, thank you, Ryan, and thank you very much for that brief, but actually to the point introduction to the webinar today. So as you'd pointed out, I mean, we're seeing and hearing lots of things about the potential of AI to transform our electronic health records and how we use them. And I think for me, it's about that shift from static, data information systems to these dynamic, intelligent tools, that can really support care decision-making and also the delivery of care. So I think what I'd like to do with my colleagues today is just start to explore all of these things in a little bit more detail. So just kicking off with the promise of AI within the context of EHRs. Lucinda, can we just maybe start with you? Can you maybe tell us what you think about how you think AI can unlock the new value from EHRs, in clinical decision-making and patient care?
So I think we could probably do a whole webinar just on this question, couldn't we? And I think Ryan started to allude to it a little bit in the introduction, but I think if we think about who can benefit first from bringing AI or having an AI-driven EHR, the benefits are incredibly broad. It's not just the patients, it's the clinicians who are delivering the care and interacting with these systems. It's the health system itself, whether that's sort of more local to the sort of the building that you're thinking about, or to the region perhaps. And it's also sort of it unlocks some population level benefits, I think, to have these AI based or AI native driven systems, and I'll just give a couple of examples of each rather than talk for too long. But I think one of the real benefits we're seeing with AI being sort of embedded into these electronic health record systems, which is a benefit both for patients but also, more broadly, is the ability to really sort of ultra personalize the information that you're giving. So whether that's, being able to from a number of levels. One is that you can access much more of the data within the record, particularly with the new sort of generative AI tools. So things that would have historically been lost in sort of a side note written on a PDF that had been scanned into a legacy system suddenly become useful information. The tools are also, better than us in many ways at sort of assimilating large amounts of knowledge in different formats and sort of highlighting what those insights might be, and being able to then use those alongside, whether it's inbuilt PubMed links or evidence sort of generation or just links into guidelines and things like that, means that you can just much better understand the patient at a data level and make much better sort of more personalized decisions. I think there are other interesting benefits for patients around communication, because one of the things that, we have these national records or national tools where perhaps individuals get access to their healthcare record via an app, for example. But what they tend to do is to reflect the EHR in terms of both the structure and the language. And one of the things we're seeing with AI, and particularly generative AI, is the ability to take that more medical language and turn it into something that is preferred and better understood by the patient in their own language, or a tone of voice, or remove some of that more technical language that is sort of impenetrable unless you've worked in that clinical space. Lots more for patients, but I think from a clinical perspective, you can bring a lot more joy to medicine if you have good tools. And being able to, we already have seen with things like the scribes built into the systems, or these sort of more these summarization tools, that it gives clinicians an opportunity to sort of be more face-to-face with patients and bring some of that empathy back to care, which obviously benefits everyone. And then I think from a sort of on the less exciting level, things for the system, if you've got tools that can take over some of those administrative functions, it benefits everyone, clinicians, but then also the system, particularly around coding and billing and things that clinical people don't necessarily want to be doing and wouldn't necessarily be the most skilled at either. So I think the benefits are very broad.
Great, thank you, Lucinda. You're quite right. We're just scratching the surface here. That last point that you touched on, just around some of almost the back office benefits, I think that leads really nicely into a question for you, Fadi, if you don't mind. Just about, what lessons do you think we can learn from recent innovations that show the potential of AI within the electronic health records to transform workflows?
So again, like you'll see a lot of things that basically are combined between all of us speakers, because again, all of us are relatively looking through the same lens nowadays. So I think the biggest advantages from experience in the healthcare IT industry right now that are visible, that are actually out there, they're not dreams anymore, would be in two areas. The bit where, as Lucinda mentioned, the personalization. I'm able to reduce a lot of the burden on the physicians now, of being able to have an AI scribe, whether it was a job or not a job. Nowadays, there's so much that can be done, and it's out there, right? There are big companies out there that have taken this market, and they take the conversation between the doctor and the patient and automatically document, automatically are able to put in orders, which reduces the documentation time, reduces the burden of having to click through boxes, which is something I haven't seen a physician absolutely say they love doing this. So it takes away the things that physicians don't like to do and gives them back the time with the patient, which is something they actually want to do. So I think that's a huge area of improvement that's come through. Another thing that is also huge is looking for the needle in the haystack. So if you've got a patient record that's, pages and pages and visits nowadays with, big AI language models and agentic AI, which is actually killing us all in technology by how fast we're able to do things now. It's impressive. With big language models now, you can actually connect the language model to the patient chart and chat with the chart to basically look for information. So instead of having to scroll through and click through, and you're optimizing all of that now, and you're actually pulling the information right at the point where the physician or the clinician is able to see the information very quickly, get what they need, not sift through the details, and be able to answer things much faster and much more accurately, which enhances the patient experience, enhances the physician experience. And on top of all that, it enhances patient safety, because nowadays you're not going to miss something because you just over-clicked one visit. So it's huge. Another piece which Lucinda also mentioned, which is the burden of all the billing things. So obviously everybody wants to get paid, and all insurers want accuracy because that's how they reduce the pay. So nowadays with AI, you can capture discrepancy, you can capture patterns in the billing issues, and then you can automatically present solutions that are based on experience of how some other patient in their billing journey was able to get their claim taken care of or paid. So there's a lot of improvements that are happening and a lot of gaps that are now being filled. I'm not going to go into the security and the privacy because that's a webinar on its own, but it's just, again, with putting enough controls on how the language models would interact with the patient, and nowadays that is doable, right? There's so much advantage that we can gain in the healthcare industry using these new tools.
Great,
So,
thanks, Fadi. I think we'll pick up on some of that when we move on to look at some of the challenges. But just to wrap up this part around of the discussion around the promise of AI, Mark, just listening to what Lucinda and Fadi have said, I mean, is there anything else that you'd like to add just from a health systems perspective about what you think the most promising areas of AI are in relation to EHR use?
Yes, of course I could, and I would, well, I would see two elements. One, which is very low-hanging fruits, what I would consider as low-hanging fruits, and this has been mentioned by both Lucinda and by Fadi. It's about, in the end, it's about resource planning. It's about administration. We all know that all healthcare systems across Europe, I would say, because that's what I know, but I'm hearing that on the other side of the globe, all healthcare systems are facing lack of resources, shortage of resources. They are all making the experience of a huge potential of optimization of the way they are using their resources. So that's really an element where AI has already, and we see that already experience on this, but where AI has already helping to improve the resource planning, and that's important. That's what I would say as a low-hanging fruit. Less exciting from an innovation perspective, but still very real in terms of resources and the shortage of resources that we have. Then with a more long-term perspective, I would certainly see that population management and prevention, which is a domain where all healthcare systems want to invest, clearly population management and prevention in particular, primary and secondary prevention, these are areas where AI can do a lot.
So, yeah, and we'll explore that a little further later, Mark, but you've raised really two very good points there about, and this goes back to the point that Lucinda and Fadi, you were both making about us being able to use AI to really interrogate the data, the wealth of data that we have in a much faster, quicker, more efficient way than we can. And when you discuss things like population management, Mark, that's absolutely a key area that we could improve on.
And not only, if you allow me, not only faster, but also broader. The huge amount of data that can be handled by AI is incomparable with what any brain, any team can achieve. So yes.
So lots and lots of promise. So now we all talked and started to scratch the surface of challenges. So let's go on and just have a look at some of those in a little bit more detail, if that's okay. And particularly where we're thinking about, how we're going to overcome some of these issues, the challenges, and how we overcome these really with a look to scaling the use of AI rather than just, little sporadic applications. So Fadi, I'll just come back to you if that's okay to kick off. Ryan touched on interoperability in his presentation. He said that, you know, a significant number of member states mentioned that as a key area of concern. So what do you think the most pressing challenges are around us to achieving interoperability in practice? And that's a big one. Now, that's a big question, I know, but just a little flavor of what you think there.
So I think the biggest challenges with interoperability are actually in two areas specifically. Obviously, there are other political challenges that, you know, will depend on the specific application in the country and the legislation that is put in place for privacy and so on and so forth. Again, I come from the US industry where HIPAA just dominates the healthcare IT industry. So it is a very concerning and important piece, but I guess that's also another topic to be handled in its own webinar. But the two areas specifically that are challenges in terms of interoperability sit with the different technical languages, and the best analogy for that is you've got a USB-C connector and you've got a lightning cable, right? They somehow need to connect, and if you don't have an adapter somehow somewhere, you've got a problem, right? So I think that is the technical piece of things. And granted, there are some very prominent solutions nowadays. So FHIR came out of the fact that all of a sudden we need to communicate and all these systems need to communicate. So it started to create an industry standard that is allowing for that adapter to exist, right? So I can't think of any of the big companies nowadays that don't have some FHIR interoperability in order to make sure that they fit into the bigger picture and the bigger ecosystem. So that is one piece, which is the technical element. And then the second piece is the difference in the meaning. You've got the same meaning of something, but it's labeled two different things, right? So there is a doctor that would call it diabetes 2, and there's another doctor that's that will call them diabetes mellitus non-insulin dependent. They're both relatively the same thing, or they have a lot of common areas, but in a way, the language model wouldn't know the difference unless we teach it. So it's very critical that we start standardizing this, and this has been a huge challenge in the industry. Granted, there are some, you know, serious changes in the industry. So we've got SNOMED and LOINC that are standardizing some of these things. But the more we're able to standardize, the more we're able to allow the AI to give us predictions in a confident manner, because we don't want hallucinations from AI, because you're dealing with patient care. We're not dealing with asking a chatbot something that, you know, if it hallucinates, isn't going to hurt anybody, because this is stuff that can hurt people's lives, right? So the more we standardize and the more we find the technical solutions, the more we're able to leverage a lot of AI pieces. So in a way, those to me would be the biggest challenges out there, and you will hear them repeatedly across the board.
Yeah, and we certainly, I'm sure that everybody on this call has great experience of hearing those. Mark, just picking up on this then, you know, I mean, Fadi mentioned things like, you know, standards, you know, and interoperability. What do you think issues like data quality standards, cross-border, you know, information sharing, how do you think they are going to complicate the integration of AI into EHR, just from your experience within Europe?
In fact, within Europe first, as opposed to what Fadi told us about the US, here we are in a very different and very lucky environment, but at the same time we are very much challenged. I'm simply here referring to this new regulation that has been adopted in March this year on European health data space, where all EHR systems are not invited but are asked to be interoperable for a limited number of data sets but still interoperable in the coming years. So 20 specification will go out in 27, then first set of data will have to be interoperable in 29, and some others in 2031 and 33. So we are very lucky from that perspective. That means what? That means that with this legislation, and in Europe, we are always saying that interoperability is first of all a matter of legislation, then of technical, as Fadi said, then on semantic, as Fadi said too, and also at organizational level. So with the standards that exist, we have solutions at technical level and at semantic level. We just need to implement them. We have now in Europe the EHRs with the regulation that really ensure that everyone will be moving in the same direction. Well, crossing fingers, and of course we are at the beginning here. Let's see how things will work in the future. But so that's first the background in which I'm making my own answer to your question. To me, what is really now important in that context for integrating AI into EHR systems is to ensure that the data that are in EHR systems are fair data. Meaning fair, meaning findable, accessible, readable, and interoperable and reusable. And in the end, these elements of fair data, this is not only technical element, this is not only legal element, this is not only semantic element, but this is also organizational element. And that's really a key important element here. If you want to have data being used by AI, they will have to be used by AI for multiple purposes. But then that means that the data need to be first of the right quality, fine, with the right standards, fine. But in fact, that means the question is, who will make this data available, this quality data available in EHR system, this coded data available within EHR system? That's a big question today. AI can help on processing the data before being used by AI. AI can help, but that's not enough, and that needs still to be implemented, and we still need to learn a lot on this. So, and also what is important, and then I will finish with that, is that it's not only about having the data being coded properly, semantically and technically, but also the data needs to be, the context in which the data have been collected needs to be defined. So with metadata and so on. So in the end, the question is how, and that's a big challenge that complicates the integration of AI, how will all these quality data be made available, by whom will they be, and by which tool will they be entered into the EHR systems?
Great, thank you, Mark. I mean, really very, very relevant points there, building on what you were talking about earlier, Fadi. And just Lucinda, if I can just bring you in then, actually, on a key point related to the issue that some of the issues Mark just raised. What do you think the risks are, thinking about the quality of the data that exists? What do you think the risks are of bias and inequity in AI, models as we're training them on EHR data, if indeed the quality and the original origin of that data is not clearly defined?
So complicated. The quality and the availability, which is sort of intimately tied to interoperability of that data, certainly have a significant impact on sort of the equity and bias in terms of the outcomes of the use of that data in AI models. I think those of us in this space, we already see the harms of health inequity more broadly, whether they're sort of individual or societal or economic or community focused. And one of the things we think about a lot is how the risk in using these tools of both amplifying existing inequities or even introducing new ones that we may not have seen before because we're using new data, larger data sets, perhaps in new ways. I think one of the I guess it ties all of these things together in that it makes it incredibly important that you're thinking about that equity and bias right from the beginning. So before you ever start coding anything or ever start, pulling together data sets or creating databases, that you are thinking about the risks of equity and bias, and you're thinking about co-creating with those who are most likely to be at risk from those inequities and those biases, and that you're open to the fact that you might not necessarily know what all of those are if you don't fully understand your data. there are, I think, from a technical perspective, we're now seeing with generative AI some interesting ways of not just imputing data, which actually can sort of amplify biases, but other ways of filling in the gaps in data sets or sort of overcoming them from a technical perspective. But I still think a lot of the work to be done to overcome the risks of inequity and bias are more people and sort of team-led, I suppose, whether that's like the co-design process or really understanding your data, which obviously technology and AI can help with. And then also just within organizations having those frameworks for analysis and for evaluating pre and post your deployment, because we also know that once we have these models live and in action, depending on how you build them, they can change over time, but also your input and your data can change over time. And so it's not a sort of a one-off risk, but it's a live risk that we need to be sort of continuously aware of.
Brilliant. Thanks, Lucinda. So that just making sure that we're aware of bias and equity right from the very start. That's great. So just thinking, moving on now from the barriers and the challenges to really how we start shifting this towards what we need to be doing from a governance and policy solution perspective. So we're really going to think about now, what do we do to talk about good governance and effective policy frameworks? What do they look like? So let's have a wee chat about that, as we would say in Scotland. So Mark, I'm going to come to you first, if that's okay.
Fine, then I will be building on my on my earlier comment.
I haven't asked a question yet, though, so wait till I ask a question, Mark. What policies do you think governments should prioritise to ensure the safe, ethical and equitable use of AI integration into EHR? So we've touched on quite a bit of this, but in brief, what do you think?
Yeah. Well, to me, first, building on top of my earlier comment, policies in relation to skills to ensure that we have enough expertise to have the data coded or to organize the data, and that's really that should be a top priority, because in the end that will be a bottleneck. Now, if this is about thinking about policies with respect to ensure safety, ethical and equitable AI integration, I would highlight two elements. In fact, first of all, again with the European perspective, any policies that would lead to meaningful implementation of EHDS would be critical. So it's not about just simply putting in place, just implementing the specs and that's it. No, if this is that, then we have lost the battle. So it's really about making it meaningful. So again, with the data having the necessary quality and the necessary format and semantic to be exploitable. That's really really the point. And this is policies which respects to not only skills but also to organization, to change management, and to all these sort of things. Now, with a focus on being equitable, I would not, if I can say so, I would not insist on the personalization of medicine, because that will happen in any case. We don't need a policymakers to work on that. That will happen. But I would certainly insist on or highlight the need for developing policies on prevention. Policies on prevention exist already, but policies which helps to rely on AI, to rely on the technology to ensure that prevention can be deployed at scale much more and with much more impact than it is used today. That would certainly be my recommendation to ensure that we are ethical and equitable.
Great, thank you, Mark. That's great. Okay, so just I'm aware that there are lots and lots of great questions in the chat, so I'd like to kind of just wrap the section up quite quickly if we can. But Lucinda, I'm just going to come to you and just ask you, what role do you think WHO's own regional strategies and action plans can play in guiding member states in this path?
So I think one of the really excellent things about the kind of regionality of the WHO is that you have access to so many sort of users and implementers and organizations across such a broad range of countries. And I think most of my work is in Europe, but extends across EMEA. And the more I work with different countries, public and private sector, you realize that like the common challenges are common. And yes, there are regional variations in regulation or in sort of cultural sensitivity to different issues, but the core of it is the same. It is often the same. And so I think anything that the sort of good position that the WHO is in, but that anything they can do to sort of understand those challenges at an individual sort of member state, but also at a regional level, and then to share as transparently and as early as possible best practices, because actually if we can find even AI isn't going to be implemented in a big bang across an entire electronic health record or an entire national system. That's an insane proposal. It's going to be adopted in sort of small pockets where you can make real impact. And often those are going to be administrative, where they release some cash and time and energy. And anything you can do to sort of capture what's been done, what went well and what didn't, and then to distribute that across the region, I think is one of the sort of best roles that can be played.
Yeah, so we can learn from each other and hopefully speed up that adoption process. That's great. Thanks, Lucinda. And Fadi, just last word from you on this point around governance and policy. I mean, are you aware of any successful examples of governance frameworks or collaborations that you think we could learn from, building on what Lucinda's just said?
First of all, I would love for it to be Big Bang, Lucinda. That would be so nice. That would make my life so much easier. But yeah, the reality is it doesn't necessarily work this way. And from experience, that tends to blow up in everybody's faces. So definitely I understand and I completely support that idea. But it would be nice. But from experience, there are two ways to push for change. And again, one of them is top down. And I call it the stick method. So you've got a government or a global initiative that says you've got to do this, and they do it usually by saying you're not going to get paid unless you meet certain criteria. And there are some examples of this. Some of them in the Middle East, such as the UAE. Without going into the depth of it, but there are examples where they basically pushed everybody to say if you don't meet X number of criteria, your pay is going to get withheld and tough luck. And there's also another example out of Europe. So Estonia has also done a great job of actually creating a standardized system that's pretty well done, within the constraints and the privacy and security of Europe. So there are actual examples where there's a push from the top down. And the other way to do this is to do it from the bottom up. So basically, you start creating enough interest for the companies and the private vendors to basically start accommodating things. And I have seen examples even where aggregators that connect to different EHRs have pushed the industry and pushed the EHRs to start accommodating the needs of the physicians. But also you have to remember all of the EHRs out there right nowadays are investing heavily in research and development to try to accommodate the wave. The wave is coming much stronger and it's not an illusion anymore. So there is so much interest and there's so much effort that's put across the industry to do this. So whether they do it top down or they do it from the bottom up, the faster people accommodate the needs, the better they're going to be in terms of the edge on the market. So there's enough pressure on everyone to do this. And the examples are plenty of how it can be done, but it will have to be tailored based on country and the limits and the requirements and privacy requirements for each area, each country, each division, right? So definitely it has to be taken into consideration.
Thanks, Fadi. And so that goes back to Lucinda's comment about how important it is for us to share, what's working and learn from each other. Okay, so just to wrap up before we go to the audience questions, we've looked at the challenges and different approaches. So let's look to the future now, and hopefully not too distant future either. So just an open question to you all. Don't mind who answers first. How can partnerships across government, industry and communities help shape a sustainable, patient-centred, person-centred, people-centred, AI-driven EHRs? So there you go. That's a That's a one line, very short question, very short answers would be great. Thank you. Mark, you've got your hand up, but Lucinda's on screen first, and you're a gentleman, so Lucinda, we'll go for
I'm happy. Yes. I'm happy for Mark to jump in.
No, go.
Okay. Well, that's an absolutely enormous question. I think there is lots that can. I think partnership is critical, and you cannot do it without partnership. So it's absolutely imperative. I think at the kind of government level, anything that can be done to encourage, implement, incentivize, mandate standards is going to be key to unlocking. And then also maintaining within those partnerships sort of open dialogues around the regulatory frameworks, because it's still it's not something we've talked about too much in this conversation, but one of the significant kind of, I wouldn't want to call it a barrier, but slowdowns, let's say, in the implementation of a lot of these tools and the access to the benefits. And so maintaining that kind of open dialogue around these issues in partnership, I think, is important. Mark, over to you.
Thank you, Lucinda. In fact, I jumped on that question because it echoed completely the definition of what ETEL, the organization I represent, is about. We are a not-for-profit organization, a collaboration platform, but the real element is that our objective is to bring on the table all type of actors. So the government, the industry, the health professionals, the patient, and all this. And the reason the reason for that is the fact that since 25 years, we believe that nothing will happen in respect to digital health if not everyone is on the table, if not everyone has something to gain out of it. And that's really so the question here is, how can partnership be successful? Is by ensuring that everyone gets a piece of the cake. It is as simple as that. And well, it's easy to be said, but it's much more difficult to say, to implement, because simply you have these public procurement rules between the industry and the public sector, but you have also the way health clinicians and health professionals can be engaged or are not engaged. And we were reflecting about co-creation, co-development, and co-design, all these sort of things. So all these elements are really key and are really key indicators of a success, of a partnership which is potentially successful.
Thank you, Mark. And Fadi, last words to you.
So it's funny enough, I feel like all three of us are reading out of the same book, because it's and that's a good thing. It's a reassuring thing, besides the fact that we haven't planned it this way. So it's good that we're all on the same page with that one. So I do agree with what Mark just said, right? So you've got three major stakeholders that we will have to get all on board, right? You've got the government or the governments, you've got the industry, and you've got the communities and the people, right? So the governments will have to set the rules. They will have to make sure that the standards are in place. The data privacy and the ethical use of AI, which is a huge piece, would have to be set by the government, so things don't go out of whack, which can happen, right? And you've got the industry, so the tech and the EHR vendors need to start basically innovating based on needs. And I think most of them are on board, because they know that this bandwagon, if they don't jump on, they lose huge market share. So they are moving fast, but the first one will have to make sure that they're moving in the right direction and not really veering into the unknown. And the last piece, which is hospital doctors and patients, they need to validate what is actually being done, if it's actually solving a problem, or it's something that's fancy, that looks cool, that has a couple of bells and whistles and dashboards. So it is critical that all three stakeholders are working in sync and going in sprints to try to actually achieve something that's usable for everyone, that's safe, and accommodated by enough vendors out there to make sure we're all moving in the same direction.
Great. Thank you, Fadi. So thank you to all three of you for your insights today. I mean, it's quite clear that we're going to need collaboration across all sectors. There's no doubt that is how we're going to be. That's the key to unlocking AI's full potential, I suppose, in healthcare going forward. But now I'd like us to turn to our audience, because we have lots of questions, I think, that we will pick up on over the next few minutes. So Ryan, do you want us just to take them in order and just see how far we get?
Hi, Donna. Yeah, sure. Go right ahead. I think there's some very pertinent questions there in relation to the discussion that we've had. So you can link them in. Over.
Great, super. So just going first up, we have a question from Dale Matty. So Dale's asking, or he's saying, we're particularly interested in identifying any use cases for health record data being used actively in supply chain decision making. So looking at prescription medicine use data to better inform demand planning, procurement, and market shaping, or looking at patient choice around place of care to guide decision making. This is a long question. So any examples of this would be appreciated. So any first thoughts on where we could signpost Dale to? Anybody from Mark, Vadi, or Lucinda?
So I'll take a stab at this just real quick, if you don't mind. So
yeah, go for it.
So there are examples. The only thing is, if you're looking at the clinical side of that example, I'm not 100% sure there's already a use case for a full-blown connecting to the healthcare piece of things. But in terms of certain things, such as where the resource planning is done, and predictive models to actually predict stock levels in supply chain, that does exist. There are so many vendors out there that actually aggregate the ERP data, and they do automatic ordering, they do stock control, they do minimum levels, and they do that whole cycle. And that's been around for a while. That's not actually very new. But connecting it to the full scope of at the front end, where the healthcare piece or the clinician interaction, I'm not sure if that has been done yet. But the back end piece, that does exist, and most of the ERP vendors, the big ones, have some sort of automatic stock control modules that do exist and do function and have been around for close to a decade, I would say. I hope that answers some of this.
Yeah, thanks, Vadi. I've got a couple of things to say about this, Mark, but you go first, please.
Yeah, I'm thinking about, so first of all, it's really about integrating IT systems in healthcare. So it's a huge not project, it's a huge program to achieve that, and there is never an end. But I'm thinking about today about the project Unicum. We tried to do it still at a large scale, but on a very narrow set of data by implementing a standard for uniquely identifying medications and the dosage of the medications and the component of the medication and so on. They are the project is transforming the medical agencies, EMA and medical agencies in the member states, in entities which are about to share data across the whole system and make the data available. So make the data available everywhere in the system as a reference point. The identification data of the medication, and that's really an example where you see an integration process not yet implemented, but in the process of being implemented on a very precise set of data.
Great. Thanks, Mark. And just going back to Dale, I won't answer it here, but I'm certainly aware of a couple of countries that are looking at this, and I'm sure that there are many more, that whole end-to-end, looking at the supply chain and looking at particularly where we're getting problems with the supply chain now. So they're looking to use AI to actually improve on that. But we'll stick that into the Q&A answers later. I'm not going to pick up on all of these questions today, just because we will not have time, but I'll just pick out some of the ones that are a little bit more, pressing, and I think that we could pick up on and answer. So just going to the next one around, this is from Elena Val, asking about what are the costs of AI and who should carry them, central or local systems, or as collaborations with the private sector. So just one of us, Lucinda, you haven't answered. So do you want to pick this one up and give us your thoughts on it?
For sure. So what are the costs? It depends. It very much depends what you're trying to deploy. If you are buying a product that just happens to contain AI, it might well feel like any software as a service type model of payment. It's going to look really different if you're trying to train your own models on the cloud, for example. Although interestingly, the cost of that is just falling all of the time. So I think we will see more of that become sort of more accessible to more organizations for sure. Where the cost should be carried, it's going to be so regionally dependent on the way these systems are set up and how much of these services are locally or sort of publicly and privately funded. I think we have to look really carefully at trying to sort of understand not just who pays, but who benefits, and where we can unlock that sort of the cash and the return on investment, and make sure that those pieces are joined up so that organizations are incentivized to kind of put the effort in and also get the health and also the financial rewards from it.
Yeah, incentives, that's a very good point. I'm going to skip ahead actually just on that point to another question that's being asked around data governance, interoperability or standards. Which comes first, particularly in EHR systems in low to middle income countries? So anybody want to pick that up? Because I think that's a really important point when we're talking about finance and resources being really tight. So where do you start? What do you prioritize?
I feel like Mark might be the man for this, but I can quickly say, I think the standards are what promote the interoperability. So they kind of come together, and the data governance ends up being a lot of the processes that mean the standards you've implemented don't drift off into being something else. So I do think they come together. There are now tools, so things like we have Open Health Stack, for example, that just make a lot of that easier if you want to build something kind of lightweight to get data, for example, into a FHIR standard. So there's tools to support with all of those things, but I do think, unfortunately, that all comes together.
Great, thanks.
In fact, to me, Donna, we cannot start with only one of them. We have to start with the three of them, because standards without interoperability will not deliver any value. Interoperability without standards is impossible. And in the end, since this is about giving value, you need to have proper data governance to ensure that that interoperability and standard delivers the value. So you have to have the three in the same time, which makes things complicated indeed.
Thanks. Thank you for that. So picking up on another one, and this is again kind of related a little bit to resources, but the point is around, for many hospitals who are still using legacy, health information systems or EHRs, and they'd like to integrate AI, should they consider purchasing whole new systems or just try and integrate with their own system? With the current software that provides AI models. So, Fadi, any thoughts on that?
So I'm being completely realistic with that one, because asking hospitals to flip systems is, again, I work on that side, right? So I work on the CIO, CTO of healthcare. If you come to me and say, let's change the system, the first answer I'll give you is, heck no, that's not going to happen. The cost of doing that and the errors and the issues that would come out of that are usually things that most places would avoid doing. As much as it would be nice if people can do this easier, but the process is not there yet. So the way to do this is to start it in steps. And that is a continuation of the previous question. If you can standardize what you've got, if you can create interoperability, and you can create interoperability even with legacy systems, and you can standardize even with legacy systems, it takes some effort, but it's a lot less effort than rip and replace. That to me is quite an undertaking that would actually halt the process of improvement. So I would say, as is, create use cases that are useful for the business. Because if you can't get the business to agree to the benefits that are coming out of this, you aren't going anywhere. But you can start with small use cases, and then find yourself growing that into lots of things. And the industry is aware of this. And when things are being introduced with AI models, they are connecting back to legacy systems. They're not excluding them, because they know if they fight the legacy systems, it's a losing battle. So I would say definitely don't think about rip and replace. Think about what we can do with what we got, how we can standardize, and how we can make sure that we use what we've got to get the best use case out of there.
Yeah, just to add to that, I think you have to think in terms of a data layer and then a UI, which might change over time or be different for different users. And we've had examples where we built, for example, with Meditech on top of their, multiple legacy systems within a hospital system, including repositories of scanned documents. And actually, one of the really cool things about some of the technology we have now is that it does start to help you overcome even some of those interoperability challenges with paper, for example, which so yeah, definitely wouldn't advocate rip and replace.
Great, thank you very much for that. So just looking at time, I'm sorry, we're not going to be able to answer all of the questions live today, but hopefully we'll be able to follow up on them offline. So Ryan, I'm going to hand back to you with one question from the chat. Is WHO planning to produce a playbook for AI-enabled EHR planning and implementation? So I think that's a very, very nice wrap up.
Thank you so much, Donna, and
That's
thank
the
you to
price
all the
you pay
speakers.
for not participating, Ryan. You got the hardest questions of them all.
Yes. Yeah, thank you all, and I think wonderful answers. And to be honest, each one of these questions that we probably raised can go into an entire webinar by themselves. So the purpose of some of these webinars is just to jumpstart that conversation, and then hopefully, there are deeper dives coming down the pipeline. But to get back to the question, Donna, just to note that WHO at the global level have actually started to put systems in place, and they have, for example, some guidance on the governance and ethical use and implementation of AI already out. There's also guidance on implementing LLMs and generative AI. So there are different aspects of guidances that WHO has started to do. Also to note, a few weeks ago, WHO Europe here, we have recently incorporated and instituted our technical advisory group for AI in healthcare. So that is something that will also be looking at a lot of these aspects to ensure safe, ethical, sustainable use and implementation of AI within the WHO European region. So these are definitely things that we may not necessarily get a playbook, so to speak, because there are so many different aspects to AI and the use and implementation of AI. And this is something that all of us actually, it's a learning process, it's an iterative process. We're all basically, to put it in a way that may sound bad, but we're actually building this ship as we go along on this journey of use of AI. And it's happening so rapidly. So it's something that we need to be able to be, to be able to shift as new information comes in, as new use cases comes in. We need to be able to rapidly adjust to these things to ensure that we're doing it in a safe, ethical, sustainable manner, etc. That's looking after the care and the needs of our populations. But we definitely are on board, and we definitely recognize the need for these guidances, and we have started to do that. On that note, I would just like to say thank you so much to our speakers and to our moderator, and also to our audience. You guys have put some really interesting and questions that we wish we had more time to answer. But as noted, this journey means that, as the speakers noted, it's an all-inclusive journey. We need to ensure that everybody's on board. Industry, governments, our patients and populations, our clinicians, all need to be a part of this, because in order to ensure that there is equity, no one is left behind, that we are catering for biases, we're catering for everything that we need to cater for to ensure safety. And again, those buzzwords, ethically implemented, safe use of AI within our EHRs. We need to ensure that everybody's at that table and having that discussion. We also need to ensure that the governance is there, and along with the interoperability and the standards, to ensure that the data quality is there. And it's not just about having good data, having good standards. It's also ensuring that the organizational aspect, as noted, is in place. They all have to work together to do this. And of course, on the technical level and everything else that was raised. And there are so many use cases that we're only as I think Donna and the rest of the speakers in the beginning, we've only just started to touch the tip of the iceberg of what is happening and what we are where we can go. So AI can help us to reach where we are going, and it can also, in that cycle, we can use AI to strengthen the systems that we're using, so we can better implement and use AI. But we have to ensure that all these building blocks that we discussed, they are in place. So again, thank you all for being here. Thank you to the audience. Thank you all. Have a wonderful rest of the day.